Have you ever wondered what you would do if you or someone with you got bitten by a snake? It's a scary thought, but knowing the right steps can make all the difference. Today, we're going to break down exactly what to do and what not to do if a snakebite happens. Stick around because this information could literally save a life. First things first, let's bust some common myths you've probably seen in movies. You know, the scenes where someone heroically sucks the venom out of a wound? Do not do that, ever. Trying to suck out the venom is not only ineffective, but it can also introduce bacteria from your mouth into the wound, making things much worse. Plus, you risk absorbing the venom yourself through any cuts or sores in your mouth. Another movie myth is cutting the wound to let it bleed out. Again, this is a huge no. Slicing open the bite area will only cause more tissue damage, increase the risk of a nasty infection, and it won't remove a significant amount of venom. The same goes for applying a tourniquet. While it might seem logical to stop the venom from spreading, a tight tourniquet can cut off blood flow completely. This can cause severe tissue damage, sometimes leading to the need for amputation. It can also concentrate the venom in one area, causing intense localized damage. We also want to avoid applying ice or electricity. Ice doesn't neutralize venom. It can actually cause frostbite and damage the tissue even more. And as for using a stun gun or any form of electricity, that's just a dangerous and completely unproven folk remedy. So now that we know what not to do, let's focus on the correct medically approved first aid for a snakebite. The absolute most important thing is to stay calm. I know it's easier said than done, but panicking increases your heart rate, which can cause the venom to circulate through your body faster. Take slow, deep breaths. The person who is bitten should try to remain as still as possible. Remember, movement also speeds up venom circulation. Step 2 is to get away from the snake to avoid a second bite. Don't try to catch or kill it. This just puts you at risk, and you don't need to bring the snake to the hospital. A clear photo from a safe distance can be helpful for identification, but don't waste time or take risks to get one. Healthcare professionals have treatments that work for various types of snake bites common to your region. The next critical step is to call for emergency medical help immediately. In the US, that's 911. In other countries, know your local emergency number. Time is the most crucial factor in snakebite treatment. While waiting for help to arrive, position the bitten person so the bite is at or slightly below the level of the heart. This can help slow the spread of venom through the lymphatic system. While you wait, there are a few more things you can do. Remove any tight clothing, watches, rings, or jewelry from around the bite area and the affected limb. Swelling is a very common symptom of venomous snake bites, and it can happen quickly. Removing these items early prevents them from cutting off circulation as the swelling progresses. Next, gently clean the wound with soap and water if you have them, but don't scrub it hard. Then cover it with a clean, dry dressing. This helps to reduce the risk of secondary infection. Now, let's talk about pressure immobilization. This technique is recommended for bites from certain types of snakes like elapids, think cobras, coral snakes, and sea snakes, which are common in places like Australia, Asia, and Africa. It's not typically recommended for viper bites, which are more common in the Americas, because it can concentrate the venom and worsen local tissue damage. If you're unsure, it's best to wait for medical guidance. But if you know it's the correct procedure for your region, here's how to do it. Apply a broad pressure bandage, like an elastic roller bandage, over the bite site. Then continue wrapping the entire limb, moving from the fingers or toes up towards the body. The bandage should be snug, but not tight enough to cut off circulation. You should still be able to slide a finger under it. After wrapping, you need to immobilize the limb with a splint. A couple of sturdy sticks or rolled up newspapers will work. This entire process is designed to slow the movement of venom through the lymphatic system, not the bloodstream. Remember, these first 8 steps are temporary measures. The definitive treatment for a serious venomous snakebite is antivenom, which can only be administered by medical professionals in a hospital setting. That's why calling for help immediately is the most important step. Don't waste time on unproven home remedies. Don't try to wait and see if symptoms develop. With snake bites, it's always better to be safe than sorry. Let's do a quick recap of the key takeaways. The DOS are: stay calm and still, call for emergency help immediately, remove tight items, gently clean and cover the wound, and keep the bite below heart level. The don'ts are: don't cut the wound, don't try to suck out the venom, don't apply a tourniquet unless instructed by an expert, and don't use ice or electricity. The best way to treat a snake bite is to avoid one in the first place. When you're hiking or in areas where snakes live, wear sturdy boots and long pants. Be mindful of where you step and place your hands. Never reach into holes or crevices you can't see into. Most snakes are not aggressive and will only bite if they feel threatened or are surprised. Give them space, and they will usually leave you alone. Snake bites can be terrifying, but being prepared with the right knowledge empowers you to act correctly and calmly. Knowing these simple but effective steps can significantly improve the outcome and prevent further harm. It's all about staying calm, getting professional help fast, and avoiding those dangerous myths. Thank you so much for watching. I hope this information was helpful. If you found value in this video, please give it a thumbs up and consider subscribing to the channel for more life-saving tips and outdoor safety advice. Stay safe out there, and we'll see you in the next video.